So, hello everybody. As Denise mentioned earlier on, I'm 21 years old, so I'm not yet done with my law school. I'm a patient. I was diagnosed at the age of 2.5 with type 1 diabetes. So my life ever since has been a struggle, but as well a joy. My struggle with diabetes has to do with the fact that basically seen nowadays, my doctors have a lot of work to do. They have a lot of workload. They have loads of patients coming in, loads of data coming in, and it all has to be analyzed, and all of the patients expect it to be done at a very high quality. Of course, we have a bottleneck there because the amount of patients with diabetes keeps growing, but as well, the number of endocrinologists remains relatively flat. So just to say, we do have a bottleneck there, and that is the point that I asked to myself, okay, what can I do here as a patient in order to help the doctors and in order to help the patients this way? That's the moment that I said to myself, okay, let's have a look into those 20 years that I lived with diabetes. Because I got it when I was 2.5 years old, so I have 20 years of logbooks that I used to note down all my treatments. I had a look into the socioeconomic impact of diabetes, but besides as well a market survey that we ran in order to establish Marjorie, a startup for which I'm working now, in which I'm the founder and working together with 2 other people, 2 from Germany, Katharina Brown and Franz. Franz is actually a medical doctor, and Katharina is just like me, a patient, but as well a medical doctor. So we're working there with a team. And it's actually pretty simple. We said to ourselves, what if actually all stakeholders of diabetes care would be involved in order to solve this bottleneck, in order to optimize the diabetes treatments? That's the moment that we said, okay, let's go pitching, let's participate in boost camps, etc. Past year, we've been supported by LifeTech Brussels, Microsoft Innovation Center, but as well Caringship Entrepreneurship Fund, in order to better do research on the current situation in diabetes care. So then we said, okay, this is our mission. We're going to aim to improve diagnostic efficiency in diabetes care by revealing concise correlations in between qualitative data into the diabetes care treatment, but as well quantitative data, such as, by example, blood glucose level and insulin intake. So just to give you a very short overview of the footprint of diabetes on global level. 1 in 12 people has diabetes. Besides, every 7 seconds, somebody dies due to diabetes. Needless to say that these are a lot of people that die, but also a lot of people have diabetes. And just to tell you, 55%, we have a growth rate of 55% by 2035 of people living with diabetes. So once again, these numbers keep growing. This is the growth rate that you can see, the impact of diabetes globally. So, as I told you earlier on, we've done a market research. Why? I wanted to see whether my feelings, my personal experience throughout those 20 years of living with diabetes are being experienced by other patients as well. What we've done is just a simple survey for patients, a survey for people touched by diabetes. These are actually people living around the individual with diabetes. Besides, we did interviews with healthcare professionals just to establish a relationship of trust. What we saw is this model. Basically, seen all the work comes down to the healthcare professional. Everybody requests time from healthcare professionals, being it on administration level, but as well just for support as a family, but as well as a patient, because you want to have input on your diabetes treatments. And then patients, of course, want to know more from product developers and R&D organizations just to know, okay, what's happening in the field of diabetes. So this has been really an eye-opening to us. Okay, everybody wants to have time from those healthcare professionals. That's the moment that we said with Marjorie, you know what? Okay, maybe helping the patients is helping the doctors. What if we could create an algorithm with which we could analyze all the data on which a lot of time is lost during consultations in order to analyze all those blood glucose measurements of past 3 to 4 months, and just simply give 3 pages to the medical doctor on which an overview is given, And also the link is shown between those quantitative and qualitative data, such as, by example, psychological well-being. And this way, we can actually say, okay, you know what? Your patient's treatment adherence is on this level. This is something we need to work on. And that is something that we simply wanted to do with Marjorie. Link data, which are all available, and I can promise you one thing, in the future, we will have more data, so the need is there in order to structure data, but as well to present them on a clear way, and link those qualitative and quantitative data. Because what we've seen in the DOWN2 study, which is a global study of diabetes care, is that basically doctors don't measure enough how patients are feeling and how patients are doing psychological, socially with their diabetes. Why? Because there's too much pressure on the doctors to get all their work done, that basic things such as psychological well-being are often forgotten in the rush of the day. So that is something that we wanted to solve by optimizing, basically seen on basis of an application in which we can actually take surveys. And that's something that I want to share with you. Please involve patients into optimizing care. And please, Denise, I would like to thank you, really, as a patient, to help us and share actually your opinion as a patient. Thank you.